Stop nighttime urination, a 5-minute bedtime routine that can help everyone. Says to drink less water before bed. Cut off fluids by 6 p.m. Reduce your intake. I heard this advice repeated for years, even by medical professionals. And honestly, for most people, waking up at night to urinate, it barely makes a difference. Because the water filling your bladder at 2 a.m. is not the water you drank at dinner. It is the water that has been sitting in your legs all day long. Hello, I'm Dr. Andrew M.D. Wolf. For more than 20 years in internal medicine and geriatric care, I've seen many adults over 60 waking up 2 or 3 times every night to use the bathroom. Most think it's because of drinking water before bed. But the real cause is often something most people never realize. Let me explain what I mean, because once you understand this, everything changes. Think of your lower legs like 2 sponges. Every hour you spend sitting or standing, gravity slowly fills those sponges with fluid. Blood plasma, lymphatic fluid, water from your tissues, it all trickles downward and collects in your calves, ankles, and feet. You do not notice it happening. Maybe your shoes feel a little tighter in the evening. Maybe your socks leave marks. But you do not think much of it. Then bedtime comes. You lie flat. And the moment your body goes horizontal, those 2 soaked sponges get squeezed. All that stored fluid has nowhere to go but back into circulation. It hits your kidneys. And your kidneys are like a factory that has no off switch. They do not know it is midnight. They just filter, produce urine, and fill your bladder. That is why you are up at 2 a.m. Then 4. Then you give up on sleep entirely. As a doctor, I will be honest. I overlooked this connection for longer than I should have. We are trained to think about bladder issues, prostate problems, overactive muscles, but sometimes the simplest explanation is the right one. The fluid is just in the wrong place at the wrong time. So here is what we are going to do. I am going to walk you through a simple bedtime routine that takes about 5 to 7 minutes. 3 phases. You do it on your bed or in a chair. And what it does is drain those sponges before you lie down for the night, so your kidneys have nothing extra to process while you sleep. But I also want to share something after the routine. A bathroom technique that most people have never heard of. It gets out the very last bit of urine hiding in your bladder, so you start the night truly empty. And then at the very end, I will go over the warning signs that tell you this is something more than fluid in your legs, and you actually need medical attention. That part is important, so please stick around for it. Quick favor before we start. If you are finding value in this, hit that like button. If you are new here, subscribe. It takes 1 second, and it helps this video reach other people who need it. All right, let us get into the routine. Phase 1. Activate the pump stations. Your calves are not just muscles, they are pump stations. Every time a calf muscle contracts, it physically squeezes the veins inside it and pushes fluid upward against gravity. When you sit all day, those pumps are basically asleep. So before we do anything else, we need to turn them on. Sit in a solid chair, feet flat on the floor. All you are going to do is rise up onto your toes, squeezing your calves hard at the top. Hold for a second, then slowly drop your heels back down. That is it. Slow toe raises. Up, squeeze, down. Think of it like priming a well pump. Each rep pushes a little more fluid north. You should feel warmth building in your calves after about 10 reps. That warmth is circulation responding. Do 15 to 20 total. If a cramp sneaks in, stop, flex your foot, wiggle your toes, and continue. This whole phase takes about 90 seconds. Good, pumps are on. Now we go after the fluid that is stuck deeper. Phase 2. Squeeze the sponges. The calf raises got surface-level fluid moving, but there is still fluid trapped deep in the tissue. The only way to move it is with direct pressure. You are going to give yourself a simple but very specific massage. Cross one ankle over the opposite knee. So if you start with your right leg, right ankle goes on left knee. Your calf is now hanging relaxed in front of you. This matters. A relaxed muscle is soft. We can push into it properly. Now take both hands and wrap them around the thickest part of your calf, like you are gripping a baseball bat. Start low, right above the heel. And here is the key. Squeeze and push upward toward the back of your knee in one slow, firm stroke, like you are wringing water out of a wet towel. Then let go, come back to the bottom, and do it again, 5 or 6 times per leg. After the squeezing, flatten your palms and do long, smooth strokes from ankle to knee. 10 times. Think of this as pushing the last of the water through the pipes. Moderate pressure, steady rhythm. Then switch legs and repeat the whole thing. Now, there are 2 mistakes I need you to avoid because they are common and they make things worse instead of better. First, always go upward, heel to knee, never knee to ankle. Pushing downward forces fluid backwards into the tissue and can actually increase swelling. Second, do not be too gentle. If your hands are just sliding across skin and you cannot feel the muscle underneath moving, you are not reaching the fluid. You need enough pressure to physically displace the tissue. Firm, not painful, but real pressure. When you finish both legs, pause and notice how they feel. Lighter, less heavy. Some of you will feel a sudden urge to visit the bathroom already. Perfect. That means fluid is moving exactly where we want it. Now, phase 3. This is where everything comes together. Phase 3. Flip the switch. We have activated the pumps. We have squeezed the sponges. Now we are going to use gravity itself to drain whatever is left, and at the same time switch your entire nervous system into sleep mode. Lie down and get your legs elevated. Either put them up against a wall or stack 2 or 3 pillows under your calves. The only thing that matters is feet above heart. The moment your legs go above your heart, gravity takes over. It starts pulling fluid from your feet and ankles back down toward your core passively. You do not have to do anything. Physics does the work. But while gravity is doing its thing, we are going to add something that makes this 10 times more effective. A breathing pattern that directly activates your vagus nerve. The vagus nerve is basically your body's power down button. When it gets stimulated, your heart rate drops, blood pressure lowers, digestion calms, and your entire system shifts into deep recovery mode. This is the state your body needs to be in for real restorative sleep. The pattern is simple. Breathe in through your nose for 4 counts. Feel your belly expand. Not your chest, your belly. Hold for 7 counts. If that is too long right now, hold for 3 or 4 and build up over time. Then exhale through your mouth for 8 counts. Slow and controlled. Lips pursed like you are blowing through a coffee straw. That is 1 cycle. Do 4. Just 4. It takes less than 2 minutes, and the effect on your nervous system is significant. I recommend this to patients even beyond nighttime urination, because the calming effect is that reliable. After your 4 breath cycles, keep your eyes closed and your legs up. And now just slowly relax each part of your body starting from your toes. Let your toes soften. Your feet go heavy. Your ankles release. Your calves completely let go. Move up through your knees, thighs, hips, lower back. Just let each part melt, like you are dimming the lights one room at a time until the whole house is dark. Stay here for 2 or 3 minutes. No rush. Let gravity finish the job. Then when you are ready, slowly bend your knees. Roll to your side. Push yourself up gently. Sit on the bed edge for a few seconds before standing, because your blood pressure needs a moment to adjust. And then walk to the bathroom. Which brings us to the technique I mentioned at the beginning. The double void. We just spent 5 minutes draining fluid from your legs back into your system. Your bladder is now as full as it is going to get tonight. This is your one chance to empty it completely before sleep. And the word completely is doing all the heavy lifting in that sentence. Here is what most people do wrong. They use the bathroom, feel finished, and walk away. But there is almost always a small reserve left. Not a lot. Maybe a few tablespoons. But that small amount is enough to wake you up 4 hours later. So instead of getting up immediately, stay seated. Gently rock your upper body forward and backward a few times. This shifts your bladder slightly and lets gravity move the remaining urine into position. Then relax completely. Do not push. Do not strain. Straining does the opposite of what you want because it tightens the muscles around the bladder. Just breathe. Let your pelvic floor soften. And wait. Almost every time, a little more comes out. Men, I specifically want to address you. Sit down for this. I know that might feel unusual, but sitting relaxes the pelvic floor in a way that standing cannot. This is not about comfort. It is about function. And the function we need right now is a completely empty bladder. That little extra you just released, that is potentially 2 more hours of unbroken sleep. Now, the honest part. I would not be doing my job if I let you walk away thinking every case of nighttime urination is solved by leg exercises. It is not. What we covered today addresses one specific and very common cause: fluid retention in the lower body. But there are situations where something else is going on and you need to know the difference. Burning or stinging during urination could mean a urinary tract infection. That needs medical treatment. Men, a weak stream that takes a long time to start, or the constant feeling that your bladder never fully empties, could indicate an enlarged prostate. Simple to check. Effective treatments exist. Constant thirst combined with large amounts of urine day and night could be a blood sugar issue. A basic blood test can catch it. And if your nighttime bathroom trips suddenly get much worse, or you experience fever, back pain, or unexplained weight loss, do not wait. See your doctor right away. Think of tonight's routine as daily maintenance, like brushing your teeth. It works for everyday buildup, but if there is something deeper going on, you need your doctor. There is never any shame in getting checked. So tonight, here is all I am asking you to do. Just try phase 3. The legs up the wall with 4 breath cycles. That is it. One thing. See how your night goes. Tomorrow night, add the massage. The night after that, add the toe raises and the double void. Build it up over a few days. Do not try to be perfect on night 1. If this helped you, hit that like button and subscribe. Every click pushes this out to someone else who is up at 3 a.m. right now feeling exhausted and thinking there is nothing they can do. There is. You deserve a full night of sleep, not as a luxury, as a basic part of living well. Thank you for being here. Sleep well tonight. I will see you in the next one.